As a bit of a disclaimer, I'm going to say this video may not be 100% what you're asking for, but what I'm going to talk about is the most common kind of stroke that I see as an emergency veterinarian. Now, while a lot of vets will call what I'm about to talk about a stroke, the technical name for it is a vestibular event. Now, a vestibular event is essentially anything that throws off our body's balance system, and a lot of people, without knowing it, have probably experienced similar-like symptoms. If you've either experienced motion sickness, vertigo, if you've ever closed your eyes and tried to walk while doing this really fast, or if you're drinking one too many margaritas on Taco Tuesday.
It's 5 o'clock right here if you know what I'm talking about.
Now, there's a lot of different things that can lead to these vestibular events, but I like to put them in one of 3 different categories. The first category of causes are the intracranial causes. The second category of causes are going to be the extracranial causes. And then the third category is going to be idiopathic vestibular disease. Now, in older dogs, idiopathic vestibular disease is going to be the #1 common cause of these events. Now, there are a lot of different common clinical signs of these vestibular events, but probably the #1 telltale sign for me that says, hey, this is a vestibular event, is something called nystagmus, which is really just a fancy way of saying rapid eye movement, and it looks a little something like this. Now, that eye movement can either be going horizontally, vertically, or what we call rotary. The only direction that gives us a clue as far as what's causing the episode is if it's vertical, and unfortunately that generally means we're dealing with an intracranial cause. So how do we treat these conditions? Honestly, we usually don't. Unless we can find an actual underlying cause of the condition, typically all we do is treat with an anti-nausea and over-the-counter Dramamine. While most animals will recover from these episodes with a little TLC, they may only get back to 80% of where they were before the episode happened, and unfortunately, full recovery may take a couple of weeks.